There's something about hip pain that feels especially unfair as we grow older. The hips, after all, carry us through life, walking us to school, lifting us through long work days, dancing us through celebrations, and steadying us in quiet moments. Yet after 60, many people find that this faithful joint begins to ache, tighten, or even resist the simple joys of movement. Whether it's getting up from a chair, climbing a few steps, or bending to pick something off the floor, hip pain has a way of making everyday life feel heavier than it should. This problem is surprisingly common. Studies show that more than half of adults over the age of 60 experience some form of hip discomfort at least a few times a week. And while it may feel like an unavoidable part of aging, the truth is that hip pain is often the body's way of signaling stiffness, weakness, or imbalance, things that can often be improved with just a little bit of care and attention each day. Why does this matter so much? Because our hips aren't just another joint. They are the foundation of mobility. Imagine a house. If the foundation shifts or cracks, the whole structure above it is affected. The same is true for our bodies. When the hips become weak or stiff, the strain often shifts upward to the back and downward to the knees. That's why people with hip pain often complain about lower back soreness or achy knees as well. The hips, in many ways, are the bridge of the body, and when that bridge struggles, the journey of movement becomes much harder. Now, what makes hip pain particularly frustrating after 60 is the way it chips away at independence. Walking to the market, gardening in the yard, playing with grandkids, or even taking a peaceful morning stroll, these simple activities can feel out of reach when every step is shadowed by discomfort. And it's not just physical. Chronic hip pain can bring emotional weight too. Frustration, loss of confidence, and sometimes even isolation if people start avoiding activities they love. Here's the hopeful part. Movement can be medicine. The hips respond beautifully to the right kind of activity. Where pain is often worsened by stillness, gentle and intentional movement often brings relief. Think of it like oiling a rusty hinge. The more you gently move it in the right way, the smoother it begins to glide. And unlike complicated medical treatments or expensive equipment, the recovery routine for hip pain can be done right at home, in just a few minutes a day. The science behind this is simple. As we age, muscles around the hips, especially the glutes, hip flexors, and smaller stabilizing muscles, tend to weaken if they aren't used often. At the same time, connective tissues can become stiffer, and cartilage may thin. These changes mean that the joint doesn't move as freely as it once did. But when we introduce small, targeted exercises, we activate those muscles again, improve blood flow, and reduce stiffness. Over time, this helps restore mobility and even reduce the strain placed on the joint itself. Think about the difference between two people at 70. One avoids movement out of fear of pain, sitting more and more each day. The hips stiffen, the muscles shrink, and the pain only grows worse. The other takes 5 minutes each morning to gently work the hips, strengthening and stretching them in ways that support daily life. Over time, this person feels steadier, walks more freely, and enjoys the confidence of knowing that movement is still theirs to claim. That small daily choice makes a massive difference. It's also important to clear up a common myth. Moving sore hips doesn't always make things worse. In fact, the right kind of movement usually makes things better. The body is designed to move, and gentle strengthening and stretching is one of the most powerful ways to support joint health. Of course, the key is knowing which movements are safe, simple, and effective, especially for older adults who may worry about balance or injury. That's exactly what this 5-minute recovery routine provides. Safe exercises that anyone can do at home without needing fancy gym equipment or long training sessions. So, why does this routine matter? Because it gives back what hip pain tries to steal: freedom, confidence, and independence. It's not just about easing discomfort. It's about unlocking the ability to move through life with less hesitation. Imagine standing up from a chair without wincing, enjoying a walk without stiffness slowing you down, or bending to hug a grandchild without fear of sharp pain. These are the small but powerful victories that a few minutes of focused care can create. And the best part is that it doesn't require hours of effort. Just 5 minutes. 5 minutes to restore what feels lost. 5 minutes to remind your hips that they can still move with strength and ease. 5 minutes that can ripple into the rest of your day, making walking easier, sleeping more comfortable, and daily activities less of a struggle. Let's begin with the first key move in this simple recovery routine. It's called the seated hip opener stretch, and it's one of the most effective yet gentle ways to release tension, restore flexibility, and start bringing comfort back into your hips. This stretch is especially helpful for older adults because it can be done right on a sturdy chair. No need to get down on the floor or worry about balance. All you need is yourself, a comfortable seat, and a few quiet minutes. Here's how it works. Sit tall in your chair with both feet flat on the ground. Slowly lift your right foot and rest the ankle gently on top of your left knee, forming a figure 4 shape with your legs. Then, while keeping your back straight, lean slightly forward until you feel a gentle stretch through the hip and outer thigh. Breathe deeply, hold for 20 to 30 seconds, and then slowly release. Switch sides and repeat with the left ankle over the right knee. That's it. A simple, approachable move that almost anyone can do. Now, what's happening here? When you cross your ankle over your knee and lean forward, you're opening up the muscles deep in your hip joint, particularly the piriformis and surrounding stabilizers. These muscles often become tight from sitting too long or from years of compensating for weak glutes. Tightness in this area doesn't just cause discomfort in the hips. It can also radiate down into the lower back or even trigger sciatica-like symptoms in the legs. By stretching them gently, you create space, reduce pressure on the nerves, and help restore a healthier range of motion. But the real magic lies in what happens over time. Imagine bending a dry twig. It snaps easily because it's brittle. Now imagine bending a green branch. It bends, flexes, and springs back without breaking. Your hips respond in the same way. Without movement, they stiffen and become brittle, making every step feel like a strain. But with regular stretching, they stay flexible, resilient, and capable of supporting you through daily activities. Just a few repetitions of the seated hip opener can make your hips feel looser almost immediately, and with practice, the benefits build day by day. Here's the best part. This exercise doesn't just help with pain, it helps with confidence. Many older adults begin to feel nervous about movement when pain sets in. They worry that bending or twisting might cause injury, but the seated hip opener proves that movement can be both safe and healing. It's a gentle reminder that your body is still capable of improvement, even after 60, 70, or 80 years of use. Each stretch is like telling your hips, I still believe in you, I still need you. That kind of encouragement matters. And let's not overlook the emotional side of this simple stretch. For many people, hip pain makes them feel older than they really are. It's discouraging to sit on the sidelines while others enjoy a walk, a trip, or a family outing. But something as easy as this daily stretch can flip the script. Instead of focusing on what you can't do, you start noticing what you can do. That shift from limitation to possibility is powerful. It's not just about stretching the hips. It's about stretching your outlook too. Think of someone who starts adding this one move into their morning routine. At first it feels small, just a few breaths while leaning forward in a chair. But after a couple of weeks, they notice it's easier to stand up from that chair without wincing. The walk to the mailbox feels lighter. Getting in and out of a car doesn't take as much effort. These little wins build momentum, and soon they're not just stretching. They're reclaiming independence. It's like opening a door that pain once tried to lock shut. Now you might be wondering, what if I feel pain while doing it? That's a smart question. The golden rule here is stretch to comfort, not to pain. A good stretch feels like a gentle pull or release, not a sharp or burning sensation. If it hurts, ease off. The goal isn't to push the hips into submission. It's to invite them back into comfort and strength. And the more consistent you are, the more those hips will respond. Another tip: pair this stretch with steady breathing. Inhale deeply as you sit tall and exhale slowly as you lean forward. Breathing calms the nervous system, reduces tension, and actually helps the muscles release more effectively. It turns the stretch into a calming ritual, not just a physical exercise. That's why many people find it relaxing enough to do before bed, easing away the stiffness that builds during the day. So why start here? Because it's accessible, safe, and immediately rewarding. It doesn't require balance like standing stretches, and it doesn't demand strength like squats or lunges. It's a gentle invitation to movement, designed to meet you exactly where you are. And once you feel the difference this stretch can make, you'll be encouraged to keep going, to add the next moves that build even more strength and freedom. Remember this: every routine begins with one step, and this stretch is that first step. It's not just about opening the hips, it's about opening the possibility that pain doesn't have to define your life. With that foundation set, let's move to the second exercise, which strengthens the hips and makes lasting change possible. Now that we've focused on opening and stretching the hips, it's time to add strength. Because while flexibility brings relief, strength is what keeps that relief lasting. Think of it like tuning a piano. Stretching loosens the strings so they can move, but strength tightens them just enough to hold harmony. Your hips need both. And the second key move in this 5-minute recovery routine does exactly that. It's called the seated leg lift with squeeze, and it works wonders for rebuilding the muscles that protect and power your hips. Here's how to do it. Sit tall in your chair with both feet flat on the ground, knees bent at 90 degrees. Place a small pillow, a folded towel, or even a soft ball between your knees. Now, gently press your knees inward against that pillow. Hold the squeeze for 3 to 5 seconds, then release. Next, keeping your back straight, lift one foot a few inches off the ground while keeping the knee bent. Hold for a moment, then lower it back down. Repeat on the other side. Start with 5 squeezes and 5 lifts per leg and gradually increase as your strength improves. It may sound simple, but here's the science behind why it works. The squeeze activates your inner thighs and hip stabilizers, muscles that often go quiet when we spend too much time sitting. These are the same muscles that help keep your pelvis steady when you walk or climb stairs. The leg lift, on the other hand, activates your hip flexors and lower abdominals, helping support the joint from the front. Together, these movements wake up a network of muscles that surround and support the hips, like reinforcing the walls around a bridge to make sure it holds strong. Why does this matter? Because one of the most common reasons older adults struggle with hip pain isn't just stiffness, it's weakness. Over the years, muscles naturally shrink if they aren't used often. This process, called sarcopenia, can begin as early as our 40s and accelerate after 60. When the muscles around the hip weaken, the joint has to work harder, creating extra strain that leads to discomfort. By adding targeted strength exercises, you're essentially giving the joint a supportive team again. With that support, every step becomes easier and less painful. Let's put this into real life. Imagine carrying groceries from the car. Without strong hips, the weight pulls on your lower back and knees, making the task exhausting. But with just a few weeks of strengthening, you notice the difference. The hips engage, the legs feel steadier, and the whole task feels lighter. Or think about climbing stairs. Weak hips make every step feel like a mountain, but stronger hips make it more like a gentle hill. These everyday victories add up, restoring confidence and independence one small movement at a time. And here's another benefit. This exercise doesn't just build strength. It protects against falls. Hip stability is one of the biggest predictors of balance in older adults. When the muscles around the hips are strong, they act like anchors, steadying the body against wobbles or slips. That means fewer stumbles, fewer near misses, and greater peace of mind when moving around the house, walking outdoors, or even playing with grandchildren. It's a form of insurance you give yourself through just a few minutes of daily effort. But let's not forget the emotional side of strength. When you start to feel your hips engaging again, There's a sense of empowerment that goes beyond the body. You begin to trust yourself more. The act of pressing the pillow, lifting your leg, and feeling those muscles fire is like a conversation with your body. I'm still strong. I'm still capable. For many seniors, that shift in mindset is just as important as the physical improvement. It changes the way you approach the day, making movement something to enjoy rather than fear. And you don't have to treat this as a formal workout. This move can be slipped into everyday life. Do it while watching the news in the morning, during a phone call with a friend, or even while waiting for the kettle to boil. Because it requires no equipment and no special setup, it fits seamlessly into your routine. That consistency is the secret. It's not about doing a lot all at once, but about doing a little bit often. Over weeks and months, that little bit transforms your hips. Now, you may wonder, what if my hips feel sore after doing this? That's normal when reawakening muscles that have been quiet for a while. Think of it as a gentle reminder that those muscles are working again. The soreness usually fades quickly and is replaced by a sense of lightness and stability. If needed, you can start with fewer repetitions and build up slowly. What matters most is that you keep showing up for your hips, day after day. The beauty of this second move is that it complements the first one perfectly. The stretch opens the hips, releasing tension, while the leg lift and squeeze build strength to hold that openness in place. Together, they form a powerful 1-2 punch, flexibility plus stability. This combination is what allows you not only to feel better now, but also to protect your hips for the years ahead. So as you press, lift, and strengthen, remember that this isn't just about exercise. It's about reclaiming your life from pain. Every squeeze is a reminder that your body can rebuild. Every lift is a small step toward freedom. And when these small steps are taken consistently, they lead to a path of independence, mobility, and confidence. We've stretched to release tension. We've strengthened to build support. Now it's time for the final piece of this 5-minute recovery routine, a movement that brings it all together. This last exercise is called the standing side step with support, and it's a gentle but powerful way to improve balance, coordination, and stability while giving the hips one more dose of strength. Here's how to do it. Stand tall near a sturdy chair, countertop, or wall that you can hold for balance if needed. With feet hip-width apart, slowly step your right foot out to the side, then bring your left foot to meet it. Step again, this time leading with the left, then bringing the right to follow. Continue stepping side to side, about 6 to 10 steps in each direction. Move slowly, stay upright, and breathe evenly. If you're just beginning, take smaller steps. Over time, as you grow more confident, you can lengthen each step and add more repetitions. This may look simple, but here's the magic behind it. The standing side step activates the gluteus medius, a key stabilizing muscle on the outer hip. This muscle is often weak in older adults, yet it plays a crucial role in balance and walking. When the gluteus medius is strong, it keeps the pelvis steady as you move. When it's weak, the pelvis tilts side to side, creating strain on the lower back and knees and making falls more likely. By practicing side steps, you're directly strengthening this muscle and training your hips to hold you steady. Think of the difference this makes in daily life. Walking across uneven ground, like grass, gravel, or a sloped sidewalk, suddenly feels safer. Getting in and out of a car doesn't pull awkwardly on the hips. Even standing at the sink to wash dishes feels easier because your hips are holding you firmly in place. These are the small but life-changing improvements that flow from giving the hips the attention they deserve. But this exercise goes beyond the physical. There's something symbolic about stepping to the side. In life, we often think forward is the only way to go. But sometimes, moving sideways, taking a different angle, trying a new approach, is exactly what brings progress. Side steps remind us that even in our 60s, 70s, and beyond, growth isn't always about speed or leaps. Sometimes it's about steady, mindful steps that keep us balanced on the journey. Now let's address an important point: safety. Balance naturally changes as we age, and many people fear falling. That's why holding on to a chair or wall while doing side steps is not a sign of weakness. It's a smart, proactive choice. Over time, as your hips grow stronger, you may find you don't need the support as much. But even with the support, your hips are still reaping the full benefit of the movement. Progress isn't about showing off, it's about showing up. Another key benefit of this final move is circulation. Side steps engage large muscles, increasing blood flow to the hips and legs. This not only nourishes the tissues with oxygen and nutrients, but also helps reduce stiffness and inflammation. That's why many people notice they feel lighter and more energized after just a few rounds of side steps. It's like waking the hips up after a long nap and telling them, "Let's move." And here's something inspiring. Routines like this don't just improve hip health, they improve overall independence. Strong, flexible, and stable hips are what allow you to keep doing the things you love. Whether that's tending to a garden, taking evening walks, playing with grandchildren, or simply enjoying the freedom to move without hesitation, it all comes back to hip health. Every stretch, squeeze, lift, and step in this 5-minute routine is an investment in your independence. Imagine this. A few weeks from now, you notice yourself getting out of bed with less stiffness. A month from now, you realize you're walking longer distances without discomfort. And 6 months from now, you're not thinking about hip pain at all. You're simply living, moving, and enjoying life the way you want to. That's the gift these small, consistent actions can give you. It's not a miracle cure, it's something better, a daily choice that builds real, lasting strength. So, as we wrap up, here's the big message. Hip pain after 60 doesn't have to control your story. Yes, it's common. Yes, it can be frustrating. But it doesn't have to define your days. With just 5 minutes of focused care, stretching to release, strengthening to support, and stepping to stabilize, you can take back control. You can reduce pain, improve movement, and remind yourself that your body is still capable of growth, healing, and resilience. If you've ever felt like your best days of movement are behind you, let this routine remind you that they're not. Your hips are not a lost cause. They're waiting for your care, your consistency, and your belief. And with just a few minutes each day, you can give them exactly what they need. So tomorrow morning or tonight before bed, pull up a chair and start with the seated hip opener. Follow with the seated leg lift with squeeze. Finish with the standing side step. That's it. 3 simple moves, 5 minutes total. Small effort, big reward. Because the truth is, independence and freedom are not about avoiding pain. They're about reclaiming strength, one gentle step at a time. You deserve to move freely. You deserve to live confidently. And your hips, with just a little daily attention, will carry you toward that independence with strength, stability, and grace.